This conference will now be recorded.
Good morning. I'm continuing the topic damage control surgery. Phase 0, phase 1 is over. Phase 2, physiological restoration. Restoration of physiology is the goal of the second phase of damage control. The principles of this phase are to break the vicious cycle of hypothermia, acidosis, and coagulopathy. Due to volume loss, leads to hypothermia. Due to hypoxia, leads to acidosis and lands in coagulation state as a disseminated intravascular coagulation, that is loss of clotting capacity. This is the vicious cycle: hypothermia, acidosis, and coagulopathy. While the correction is described here in the second phase of damage control, it should begin on first contact with the patient. Hypothermia leads to acidosis, acidosis leads to coagulopathy, further progresses the hypothermia. This is cycle which ultimately leads to the death due to shock. Hypothermia is generally defined as a core body temperature less than 35 degrees centigrade. Its severity is usually divided into those temperatures less than 35 degrees, 32 to 35, and less than 32. Hypothermia affects coagulation by decreasing platelet activation and adhesion, and by slowing down the metabolic rate of coagulation factor enzymes. How the hypothermia affects on coagulation: decreasing the platelet activation and adhesion, followed by slowing down the enzymatic activation. Normal body temperature, the enzymes are active. When the body temperature comes down or too high leads to denaturation. Too low leads ineffective inactivity. Treatment begins with on-scene care, which can include removal of wet clothing and quickly covering the patient after exposure with warm blankets, warm intravenous fluids, and blood products should be used as soon as the ability to deliver such warming is available. Ventilator circuits should be warmed and humidified. Acidosis disrupts the coagulation system through an inhibition of key enzyme activity. Its effects on coagulation are potentiated in the hypothermic patients. Following base deficit and lactate levels provide some evidence that the resuscitation is heading in right direction. There is decrease in lactate levels and base deficit shows resuscitation is in positive way. Acidosis: should the patient's pH demonstrate a severe metabolic acidosis, pH is less than 7.2, normally 7.35 to 7.45. Sodium bicarbonate can be used as buffer until the resuscitation efforts have caught up. Trauma associated coagulopathy is present in up to a 1/3 of trauma patients on admission. It is now well accepted that the use of fresh frozen plasma and platelets should start earlier and in higher ratios than has been traditionally administered. The assessment of blood consumption score provides rapid identification of patients who will require massive transfusion, that is more than 10 units within 24 hours. If any of the following continue are identified, the patient has almost a 40% incidence of requiring massive transfusion. Heart rate, when it first seeing the patient, heart rate was more than 120. Systolic blood pressure was less than 90.